now reconvenes with discussions of the fiscal year 2017 budget proposal from the Department of Public Health and Social Services. I want to preface this budget hearing and future hearings with the fact that the government of Guam currently has a FY 2015 cumulative general fund deficit of $120 million. Now more than ever, we all have to understand that increasing expenditures against potentially declining or flat revenue levels may not be realistic. We may all have to come to that realization either now or sometime in the future. With that, Director Gillen, you may make your statement.
Good morning, Mr. Chairman, Vice Speaker. Good morning, Senator Rodriguez, Senator Adda, Senator Ogden, Senator Torres. We're at your disposal. We submitted our narratives where we were explaining where the differences were, or where the increases were, to your committee several days ago. So we're ready to respond to any questions you have.
Okay.
I have, by the way, I have the division heads here. Arthur St. Augustine from Division of Senior Citizens, Tess Archangel from...
Okay, I thought that you were going to make that presentation this morning. Did you make copies of those for everybody else? The most recent emails.
Sorry, I assumed that your staff would have made
Well,
those
I
available.
wasn't sure that was going to be made public yet.
Well, there's one item there that that you obviously have to look at, but is going to be something I hope you would just hold. So, I'm not quite sure. I've been told several times by very smart people that it's a wise person who knows what they don't know, and so that's why I brought all of these people with me. Budgeting and finance is definitely not my forte. And I have people here. I have Josie O'Malley, who is the acting Chief Public Health Officer, so she represents the Division of Public Health, and she was given fairly short notice that she was going to have to deal with this, and that's why we also have our program people here. If there are any specifics, I have Tom Nadeau on my left, your right, who is the head of the Division of Environmental Health. Mr. Tommy Tidegway, who is the Administrative Service Officer, has a tremendous responsibility for the whole department, grossly underpaid, by the way, who has taken his leave celebrating his anniversary, put it on hold to come to this hearing. Again, we know that we couldn't know in advance how soon you would call us in, so we thank Tommy for taking the time for that. And of course, Tess Archangel, who is the Administrator of the Division of Public Welfare. So those are the major divisions, and of course, the Division of General Administration.
Okay, why don't we do this? Why don't you go ahead and explain your narrative so that the others can have the benefit of it?
Okay. Well, we had attempted to show that in our narrative where there were changes, and obviously, when we submitted the budget, it was based upon a certification that was given in April by the Bureau of Budget and Management Research, based on documents that we prepared even prior to that. Things change. There's never, it's always kind of flowing. We're really looking at, a different, at least in our request for fiscal year 17. I have to put my glasses on, I'm sorry. Actually, roughly 5.67% less what we were requesting. We do have what would show in the budget narrative, the digest, an increase in positions. And we also have to note that while your letter to us, or your notice to us about the hearing, speaks to justifying the increase over the appropriation of level of 49,513. We also have to note there's additional money there that was in Section 2 that has to be added to that amount. Okay. So it's not just 49 million. I'd like to have Mr. Taigwe now discuss where we're at with this.
I really do think that if you would just go through the narrative that you sent down explaining, none of the committee members have had benefit of that.
I can do that. I can go by through each division's request.
Okay.
And maybe
Go ahead.
have them expand.
Make sure your mic's on.
Overall.
I just want, I don't understand why. I mean, we sent this to you. I mean, I don't want to be really argumentative, but it was available to your staff and to your committee. Sent it to you early this week?
Well, yes, but I didn't know that was. All right, let's just start off.
Well, I mean, I thought was your request was to explain where there either differences or any differences between 49 million, which is understated, and what we have been requesting. So, and again, it's here for you. Tommy will go through it. I just thought that perhaps the committee already had access to this information.
And the narrative that you sent down with the increases, had that been vetted by BBMR and approved by Adelup?
It's based upon what they had allotted for us.
It stays within the budget ceiling that the governor sent down in the executive budget request in February?
Yes.
It was certified by BBMR in April.
Yes.
Yes.
So, Mr. Chairman, if I may, I guess in response to your question of, hey, we sent this down to you, how come, and I'll tell you right now, I'm not a member of this committee, but I came here because I want to listen to the information and make an informed decision when we get on the floor. Right?
Thank you.
So if nothing else, for my benefit, who has not
Sure.
read it.
Sure. All right. Tommy, we can go through. Thank you.
Your initial inquiry with the 49 million, though we indicate that this current year's request was at a level of 95 million. The 49 million was specific to Section 1, which included the special funds and then the general fund money. But it didn't include the line item appropriations that directly came from the general fund and not Section 1. Those items include like MIP 15.5 or 15.6 million, the MIP cancer treatment and screening, which amounts to 1 million. So in essence, also what we put away for FGIA, that was a little bit overstated in that.
I think you can, if the acronyms you could explain.
Okay.
For everybody else.
The federal's grant in aid, the matching programs, we were provided 29 million when we only really needed like 21 million in terms of what we requested in FY16. So in all, the amount is like 95.3 million of what's authorized for this FY. The 49 million plus the 15 million or 15.6 million, the 1 million for cancer screening and treatment, and then the amount of 350,000 for the foster children health insurance, and that's how that amounts to 95 million.
But there was an increase in your insurance program, Medicaid assistance program for the children. It went from 8,792,000 in the governor's budget request and it went up to 11,683,996 in your digest.
This is a result of, we currently have a waiver in place to allow us for a 10% local match and a 90% federal match. That waiver expires this fiscal year. So we're now having to budget for a matching ratio of 45% local, 55% federal. So that was a result of why that increase was significant.
And there was also an increase in the medically indigent program. For some reason, the executive budget request that came down in February set that at $12,473,880. In your request, it's $15,828,907.
Yeah, we had to go back and reduce that, only to complement the requirement for like foster care and also the children's health insurance program.
What did you have to reduce? I was talking about the medically indigent program.
The MIP program.
Yeah, the MIP program. You increased it by $3,355,000.
And our request, the most recent request, we reduced it to 12. By 3 million.
Okay. Tess, I'm having you fly me around the world several times for dinner. How much did you spend in MIP this last year?
To date.
Today.
To date. To date, we have spent, based on the last quarter report, we roughly spent, it's not here, 6 million for MIP. The reason being is because we charge MIP emergency services to Medicaid, and we utilize the local money, the MIP, to pay for the match.
So
that saves us money.
I understand that you were moving them over, but I'm just trying to figure out.
No, we're not. That's a different scenario. That's Group 8. That's the childless adult. What I'm talking about are those MIP clients that are undocumented, like the FAS citizens. We're charging them to Medicaid, but they are really under MIP because we lobbied to CMS, and because of the increase in funding of ACA, we're charging inpatient services, hemodialysis, ER services, as well as delivery to Medicaid, though they are under MIP. So we're utilizing MIP money to match that.
Okay, so in previous years, we've gone as high as
24 million.
24.
Yes.
And 12 is going to be sufficient this year.
You never, Senator.
You're going
I
to ask me for
understand.
dinner
When
again.
you tell me and you say it looks good because the last quarter was March.
Yes,
But
for
And
MIP. But
yeah.
but
So it looks good, but I'm just asking.
Right.
How is this year going to end? How did last year's end, maybe?
where we still
Because you were doing this matching program last year, right?
yeah we were
So how did you do last year?
we were able to pay as much claims as we can based on the local funding that was given to us.
So you
but I
utilized
have
the
to
total 16 from last year.
Yes,
And
utilizing some of it to match the MIP emergency charge to Medicaid.
how much did you carry over into this year?
For MIP, roughly 2 million.
So last year's was insufficient by 2 million.
Well,
But
you need to take into consideration the processing time because, those claims that's received late part of August, and as well as in September, they are being processed in October because we have 45 days processing time. So those claims that we receive back is carried over to the next fiscal year because we cannot process the claim that you just submitted now. I mean towards the end of the fiscal year. So we have roughly 2 million carryover, but with Medicaid, we have 21 million carried over to the next fiscal year.
So this is, the amount that's in here is sufficient.
If you continue to allow us to roll into the new fiscal year, that claims runoff, that's the incurred but not reported, okay, which Tess is talking about. You know, eventually it's going to catch up to us because the claims get larger and larger. But we're still trying to at least show that given our experience, that we're able to do this with less than what we initially asked for MIP. As long as ACA is still available, and as long as the feds allow us to move some of those expenses from MIP into the federal match program.
If we're just going to utilize this for the services of MIP, excluding the MIP ER, yes, it's enough. But we are utilizing it to match the MIP ER, which is being charged to Medicaid.
Okay, so which amount do you want, the 12 or the 15? The governor says 12, you're asking for 15. You're saying that the first quarter only was 6. Would the second quarter be 6?
That's first and second quarter.
I understand.
So technically, if you're going to assess it based on the first and second quarter, you will also need 6 for the third and the fourth quarter.
So do you need 15 that you made in your last request?
But you have to give me... you have to give me additional money to match the ACA.
Now, I think it's a great program that you're doing. I thought it was ingenious that we finally did that. I'm just saying I need to know what it is that you need because I have 2 separate numbers. One that came down in the governor's executive budget request and one that came down in your digest and your most recent upgrade. Now, which number should I use and which number has been approved by BBMR in downtown?
All I can say, Senator, is we spent 85 million or 80 million in fiscal year 2015 for Medicaid. We're spending more than that for Medicaid this fiscal year.
Yes, I noticed that because there in your digest you have Exhibit A and B, and I'm trying to figure out whether or not that got lost somewhere and it didn't get added at the end. Because in A and B, the Medicaid payment for affordable care match was $30,094,545, and Medicaid assistance was childless adult payment of $13,812,000. That 48 million, was that included in the 95? I see you shaking your head.
We were given the authority to move transfer funds at will, so with a lot
get on the microphone.
With a lot of the money, the local money that we use for match, we had the ability, or BBMR had the ability to move the monies from what we set aside on reserve, and these prior couple years, we've been able to provide for that ACA match, the Affordable Care Act match.
Okay, and that's what I'm trying to get to, is in the disc that you sent down, which is not the governor's executive budget digest, request, but was your detailed budget, did you intend for us to see those two requests of one for 30 and one for 18? Because is that included in your 95 or $100 million cap? Because it doesn't seem to me, to us, no, it's not, does it?
No, it doesn't.
It's not in the within the cap.
No, sir.
And so you've sent to us, yes, Jim, you sent us two documents that would take your budget $48 million over the cap. $48 million. We look at the stuff that you send us,
I understand.
and I'm just asking, was that intentional? Because it wasn't added onto, at least we didn't think that it was part of the 95, and you've just confirmed it's not part of the 95, right?
Yes, that's correct. But initially, when we submitted that first document, we weren't provided a ceiling.
I understand, because all of them, and I know Senator Ogden has left, but there's an amount that you guys all sent down, your initial request last January to the front office, all right? Which included all of this. BBMR and Adeloop, the fiscal team, made a decision and wrote an executive budget request that was sent down to us that did not include this $48 million. That document was still sent to us. Is it to be included in your request? Because if it does, it throws the governor's budget off by $48 million.
No, it's not intended to be included.
It's not intended to be included.
That was in January. That was the dream budget. That was what we were hoping to get. What the governor's people had done was look at least some accurate projection of what the revenues were going to be and cut the pie up this way. We're going to, if we find ourselves short, the governor still has transfer authority. I don't know what you're going to do with the fiscal year 17 budget as far as that goes. Probably use, if we do have problems in finding matching funds for Medicaid programs, use the 15% reserve, which we can modify the allotments to find the matching money. We've done this year after year after year.
No,
and then you hold
understand.
another 2%, 2 or 3%. So from day one we're already at minus 17%.
I understand, Jim. I'm just saying that
I get you.
it got down to us.
Right.
And when we were looking at it, we were like, this is $48 million more than, and I just wanted it on the record that is not part of the request that you're coming in with today, and you're going to live within the digest that
the request is based upon what
the governor's
BBMR certified.
Okay.
Thank you, sir. And I'm sorry again, Senator Ada, I didn't know that you did not have access to this. I don't know who's on whose committee, so I really don't.
I thought that I would just let you make your presentation. In our letter to you, we tell you to do an explanation for the committee.
We thought we could shortcut it by sending the narratives in advance. I
Yeah,
know you have a
but
long
it doesn't.
schedule today.
It doesn't. Yeah. If that's why we walk through all of it so that everybody understands. Any questions?
Hafide, good morning.
Morning, sir.
I have some questions that I prepared, and maybe we can just go back to those later.
No, go ahead and.
Okay, first with the HPLO, I saw the your explanation here, and kind of there's a slight increase in the budget that you're requesting for HPLO. Does that address the full concerns of how it's not staff, and right now you're just borrowing from different programs?
Yeah,
If you can explain that.
It doesn't really probably come close enough to what we need. As you know, there's so many boards of examiners, but the most complex one or complicated one is the Board of Allied Health Professionals, which is about 16 different disciplines. So just keeping track of the meetings and the minutes and doing all of that, we need those word processing people. We still are relying on the Office of the Attorney General for advice in terms of how we can proceed legally. What our plans have been over time, and we haven't been successful, is trying to find either administrative hearing officers through an open requisition for maybe about $14,000. So on an as-needed basis when we do have disputes or disagreements. That whole activity of professional licensing, requires a lot more funding than what's there. But again, we're forced to live within our means, and I think that at least adding those positions will help us get our jobs done.
Okay, I don't think it's here in the submission, but there was an analysis done. Maybe Tommy, you helped put this together with BBMR. I'm not sure. Maybe you can clarify. We had a Bill 165, that was looking at kind of revamping the HPLO and putting it under this new bureau that was being proposed. So part of that was looking at the budget on how it would be if we did that. And I did see it. I didn't bring it with me, but that amount was about, I think it was about $500,000, and that would fully staff the HPLO, and that was just the government subsidy. That's not even taking into account the revenues that come in from the different commissions and boards, because that's still needed, to fund, like Jim has said, the hearing officers and the attorneys for the different boards. Is that something you helped put together?
Not if I wasn't directly involved in that I guess the makeup of the bill, right?
No, but just the budget analysis, the proposal that if it did shift to a separate bureau, that's what it would cost.
Yeah.
So no, okay. If not, then maybe, Mr. Chairman, I want to be able to present that to you, to the committee, just to at least review and see how that can kind of fit into what your request is.
Yeah, I think we've had these discussions before about reviewing the fees that are being charged for relicensing and even for initial licensing, and they're just not even close enough to capturing even what our current expenses are. I mean, when you look at a physician renewal for, I think, 2 years, it's like $200. A license to practice medicine is worth a lot more than that to a physician. We have the same thing with cosmetology, with all of those. I mean, $4 for a cosmetology license. A lot of those things are out of whack, and nobody likes to talk about increasing fees. We understand that, but there comes a point where you're not even matching up with what it costs you to run, even at the minimal staffing levels we have now.
So statute's been there. It's never been impaneled, but the Commission on Healing Arts, that's where the different board chairs, and I think you as a director is a member. So we've reached out. We wrote to the governor and asked him to impanel, because that's where you're right. We need to start reviewing these rates that haven't been been looked at, the fees. But that again is going to be separate from what is included in your budget, because that would fund the different boards and commissions. But this one that I saw, the proposal was funded through your executive budget. So that's where I will present it to the committee and also provide you that copy. But I believe it was done in consultation, perhaps with the HPLO office. Okay, so that's one May I ask another question? The other question I have is in the Division of Environmental Health. There was in 2010, I believe, there was a move to modernize the different positions of the inspectors over at DEH. And so there was a lot of back and forth. I believe Senator, he's left. Senator Uggan was the author of that. And so from then, there was a lot of back and forth and revisions that had to be made in statute. So we got that, we got that done. There's one now pending before us, which is Bill 184, which provides this incentive to the inspectors, which they're called EPHO,
the Environmental Public Health
Officers. That's right. And if you can explain how it's even more important now to be able to pursue that because of the recent conclusion that DOA HR has come up with in terms of the Competitive Wage Act appeal that the division had moved forward. If you can explain that to us.
Thank you very much, Senator. Prior to the passage of the Modernization Act in 2010, prior to that, our division had great difficulties in recruiting. Basically, the pay was insufficient to attract to qualify individuals to work in Division of Environmental Health. With the passage of that law, which increased not just simply the salary, but also the qualifications of our staff, it helped to attract and help us to recruit. But as a result of the Hay study, basically everyone's salary came up to, if you will, to EPA's level for the same type of jobs. So we're back where we were prior to 2010. We're competing for the same group of applicants and now for the same pay, but our staff has higher qualifications, and greater certification requirements. So we're at a disadvantage once again. The salary is the same for the same type of work, but yet we're requiring additional higher qualifications and additional certifications. So as I mentioned, it just goes back where we were prior to even our Modernization Act. So the incentive pay, which is not just a simple pay increase, but something that's earned by the staff through 5 certifications, I think that will help us once again, let's make the division competitive and not just simply recruiting, but retaining the staff that we have. Thank you.
And I think what's important, this is not just about wanting to provide a pay raise to employees. Right now, there's services. I mean, I had, and I shared with you in a meeting we had yesterday, a young entrepreneur that wants to open up his business, but the scheduling now is a month or 2 months down the road. And if you want to get an inspector to come, you have this expedited fee that they have to pay, but then it jeopardizes the other things that have to be done. So that's why we need to understand, and for everyone to understand how important it is to, as the intent was in 2010, to modernize and these positions and be able to retain who you have and be able to attract those. Director, I know you want to add.
Senator, I think really, and I think the incentive pay is probably
Are you on?
Yeah.
I don't see the light. Oh.
It's the better way to go, I think, because you need to find that money only at the time that they qualify, continue their licensing or certifications. So it's not something you have to find. I'm right here. It's not something that you have to find every year. When you give a pay raise, you've got to find that every year. So these incentive payments really are a little bit more practical. You still keep a qualified, very specialized staff. If you look at Title 10 and you look at environmental health and all of the mandates, I mean, it's a list about this long, and we can't, Tom's people just cannot continue to operate, under the pretense that we're meeting all of those mandates, because it's not. We respond to every complaint, every concern, okay, but we're not doing a consistent job because of shortages and the fact that we cannot attract qualified people because we are competing with agencies who have a little bit less to do, but are getting paid either equivalent or more. So this incentive payment will help. And
so does your budget reflect that if that is enacted, that you'll be able to cover this with the 2 funds that I know that Bill 184 had identified, which is the Environmental Health Fund and the SIRF, right? The Sanitary Inspection Revolving Fund.
Right, Sanitary Inspection Revolving Fund, right. Well, we can even we actually have the funding as now, this fiscal year. And if we're authorized to retain the lapse of the special fund, that just increases our ability to fund the incentive pay if it was to go through. So I'm not anticipating any shortfalls or challenges in funding the Bill 184 if it does pass. It's just now a matter of can we get the staff to fill the positions, and will my staff willing to stay within the Division of Environmental Health, considering the recent findings of DOA's pay reevaluation.
I thought that I recall that there was a public law that was enacted which authorized public health to actually utilize third-party inspectors when your workload just and so that law would have allowed you, recognizing the difficulty in hiring and whatnot, but I know that when it was introduced, it was in anticipation of the military buildup, and you were going to have this additional workload. So, is that at all being utilized?
We just recruited, and this individual will be starting work the 20th of July, so next week, I believe. She'll be funded through that particular the SIR fund, otherwise known as the Sanitary Inspection Revolving Fund. So her primary responsibility, to do just that. We still do have close to 100 temporary workforce housing that needs to be inspected according to that particular law of different phase inspections. So once we get that person aboard, trained, we're confident we can meet the mandate for that. Now, however, if we were to have that military increase that we're anticipating a couple of years down the line, that'll definitely be challenged, and we'll hopefully be given a greater increase in fund for that particular fund. increase in numbers for that particular fund.
So are you suggesting that with that new person coming on board, we won't have situations that was, for example, that was just described by Senator Rodriguez, with a new business owner having to wait 2-3 months to get the inspection?
The person we're hiring is an entry-level position as an Environmental Public Officer 1. Their primary role is doing compliance inspection. The individuals who do the pre-operation inspections, which require greater qualification and more knowledge, that's handled by the next tier level, which is the 2 level. And there is a vacancy at this moment that we're trying to fill, but right now we only have one individual dedicated to do just that, and thus the delay of much as 2 weeks on the average till business is inspected for a pre-operation inspection.
Okay, so going back to my original question then, has public health looked at using a third-party inspection company to do these day-to-day stuff with public health using its personnel to basically just provide the quality control for that work?
Yeah, okay. That particular law that created the SIR fund stated that in order for us to even pursue that avenue, the third-party inspection, is that we need to exhaust all opportunities granted in that law, which is one, recruit something like 15 positions, and also utilizing the graduates from GCC and EOG, as I recall. It's only upon then we're not able to fulfill that obligation. Then we are to turn to the independent third-party inspections. Currently, as I shared with you during the public hearing for that particular rules and regulations, we will be able to meet the current mandate if we were to get that individual hired just to do the compliance inspections. But if there's a sudden increase in the temporary workforce housing applications, of course, that will impact our pre-operation inspections, which is a separate kind of inspections before in order to get a sanitary permit. That would be challenged, but we're hoping the vacant funded 2 position will be filled to make that possible. So in summary, Senator, to answer your question, have we looked at it? No, because we believe we can meet the current need, but we'll be able to do so a couple of years from now when there's a sudden increase in number of temporary workforce housing. Possibly not.
Okay, so let me just close by saying then that if you think that there's legislative obstacles that were not necessarily intended to be obstacles that need to be looked at in order to give you that additional tool, then I think that needs to be identified, and let's let's see what we can do to remove it. Okay.
And Tom, the law that authorizes the third party, that's specific just for workforce housing, right?
The way
law
it's
is?
worded, it's primarily for that, but as I shared with you last time as well during the public hearing, I think we can interpret it as such to other operations as well, depending on interpretation, and I suppose we need to seek the Attorney General's office for interpretation to ensure we're consistent. But it's primarily for that, but as I read it, or as we've read in our division, it gives the impression that it's operation, which can include general environmental health operation. But once again, if that's something concern to the senators, we definitely encourage that language to be revised so be explicit saying it's not just specific to temporary workforce housing. So we can definitely use that funding for other operations like lab operation and other compliance inspections and investigations.
Okay, so I think that's what the Senator Ada had
Okay.
perhaps
Well,
suggested.
thank you for clarification.
Is
My
that
apologies.
you provide us that so that we could make those clarifications.
Then that would be great if we could maybe further clarify the language within that particular law to allow us to cover the entire operation of the Division of Environmental Health as opposed to specific to temporary workforce housing.
I think I was the sponsor for that bill, so
Yes, sure, Senator.
you know, I'm certainly open to sitting down with you anytime to see how we need to reinterpret that.
Thank you very much, Senator.
Right.
Mr. Chairman, just two more things. One is the senior citizen. I don't know if he has a separate explanation, but if I'm going to ask Art. Right now, you're in emergency procurement for the food services, and I know that's costing more than what the contract is for food services. How is that being covered now? What's the difference? And going into the fiscal year in October, what do you anticipate? Are we still going to be in emergency procurement?
Can't really say we're going to be in an emergency procurement, Senator, walking into fiscal year 2017. We are actually working right now on a bid, and so that has to move forward from the division. With regard to the current cost, it has increased, and that's unfortunately the nature of this emergency procurement process. It's not negotiable. Neither are bids. We can't really negotiate the bid amount that is proposed. So right now we're paying much more than we were paying the prior vendor prior to termination. In terms of what we actually need is our projection, and because we don't know once the bid is open, announced, and the potential or awarded bidder is awarded, it will definitely impact our costs, what we project for 2017 versus what the actual cost will be. But they're all going to be just projections at this time. Actually, Charlene's pulling that out right now.
What we have to be concerned about and aware of is that this is now at the public auditor,
Right.
As a protest, and I don't know how long that's going to last for her to make a determination, and then whether or not that's still going to wind up in court. So who knows where we're going to go with this, but we have to project the worst case. But we have gotten people saying, why are you doing something like this when you were getting such a good deal on the price, and now you're paying almost 3 times as much on an emergency procurement? Well, we are not going to compromise the safety and the health of our senior citizens. This is a highly susceptible population, especially those who are at home, who have difficulties with the activities of daily living. Some are very, bedridden and very ill. We can't afford to let a contractor slide and then, come and fix it, overnight, and it's really just a physical plant fix. It has nothing to do with their operational, how they operate and how they deal with preparing the food. I mean, if we need to go to a public hearing on this, where we can show you the pictures of the facility that we have closed a few times and graded a D several times, and their claim publicly is that for some reason we're doing them an injustice. No, we want to make sure that our seniors don't get any problems with the food that they're receiving, despite the fact that even the Mayor's Council is now saying, why are you spending so much money on food when you could have kept it at $3? I will tell you, and if you want to look at the bid document that we signed way back when, I wrote on both of the quotes for the home delivered and the congregate meals that I felt that this price was too low. Okay, and I think that's being tested out now when we see what happens in that facility. So, you know, we're paying more. It's not in this. Was not contemplated in this budget submittal. You know, we'll have to figure a way to see if we can continue to cover this. We don't know how long it's going to take to get a bid out, but I can assure you that a responsible bidder is not going to bid the price that the previous contractor had. I just don't see how you can do that at that price.
So how much is in this budget for that?
There's nothing in this budget for that. We based this budget again on, at the time, what the contracted price was.
So it's based on the $3.
Yes, sir.
And what do you believe to be the reasonable amount?
That is not a reasonable amount.
No, I mean, I know.
sorry.
What do you believe to be the reasonable amount that should be budgeted
I don't
for?
know. I mean, when you go to some of these places and it's a one choice, two choice place and it's more than $5 now, $6 now. There is some savings when you're doing it for several thousand meals. But I don't know what a reasonable price is, but I know that what we were paying was just not. But that's, again, GSA has the obligation to get the best price they can. That's not always the best deal in the long run. And this is one of those instances. So we're forced into this situation again. It was like when we were trying to get a bid done initially for seniors meals, and it took forever. You remember you asking me, when are we going to get through this? So at least we've got the template down. We shouldn't have those delays in putting all of that together. It's just going to be, getting it out, get responsible bids, and then see, what the price will be. I'm sure it's going to be a lot less than what the emergency procurement price is.
Okay, and what's the emergency procurement price?
The emergency procurement price right now is $8.50. And that is our $8.50 for congregate, and that's over at our senior centers and daycare centers.
And how many meals are we doing per day, or the total? What's the total amount that's currently in the budget? If we were to double it to get to 6, what's the current in the amount? I mean, just say me.
The current budget for 2017 for congregate is at $640,585.
So if we were to double it,
Right. It'll be 1.2 approximately.
and that would be closer to what you consider might be a reasonable, I mean,
That's congregate only.
That's congregate, correct.
Home delivered is what?
Home delivered, I believe is.
That's the senior centers.
So our senior centers and our
Sorry.
3 daycare centers is our congregate feeding sites. And then we have the home delivered component, and there it's $9.95 per meal. That's the emergency procurement price. So what was the price before that? 507. And so for congregate, we feed approximately, our cap is 780. That's our 15 sites, 12 senior citizen centers and 3 daycare centers. And then for home delivered, it's 1,180 seniors that we have maximum capacity per service day. And right now that price is at $9.95.
you've made some amendments in your submission the other day. Can you please send us something in writing from
Sure.
Senior Citizens Division about this one specific problem that we should be considering? Because as I see it right now, we've not adequately addressed the need for the meals, congregate and home delivery. So
Yes.
it sounds to me like that's an additional $1 million that you're going to be requesting.
And I think, Mr. Chairman, you have to realize that that's all going to be local money. All
Yeah,
gonna be
no,
federal
I understand.
participation.
I'm just saying, we need to know. I mean,
I agree. Yeah,
it would really look bad if we didn't provide. I mean, and I understand the need to increase the child insurance program by that 3 million. I mean, and when we had the testimony of the foster parents, it just made it so much easier for all of them to be able to address the needs of their foster children. So I don't imagine that anybody here is going to, but I just want to point out, and then on the MIP, you guys are increasing it by 3. So we're talking about just between those 3, about 8 million, 7.5, almost 8, difference from what was originally transmitted, even if I disregard your wish list of that other 48 million. Okay, but please send me how much I should try to plan for in this
Yes,
one.
well, we will do that.
And they were talking about vacancies. How many funded vacancies do you currently have that that you've not filled?
I don't have that number right now, but I'm not sure if the individual divisions may have that number. Yeah. Just within the Division of Public Welfare, you're looking at like 32 unfunded, I mean, funded positions that are vacant.
Okay, because my count is 112 funded vacancies.
Department-wide.
Department-wide. And so my next question is, how many of these vacancies do you reasonably expect to fill in the next 3 months, knowing Department of Administration's ability to send anybody any kind of listing?
I think, so far we've gotten some fairly good cooperation from Director Boleto, more so than we've ever had with DOE in the past. We have real severe shortages in our eligibility specialist series. And part of that is one, just the Hay study alone. There are nutrition aides, nutrition assistants, I think, that are in the WIC program who make more money than eligibility workers. And eligibility workers have to make, several complex decisions about whether or not a person is eligible, even though, there are certain guidelines that they can follow to make those determinations. But our error rates in our SNAP program are unacceptably high. Some of that has to do with our clients not cooperating, but the feds still count that as an error. But we have a real severe shortage, and to the point where the people who are there are just overwhelmed. We're seeing, 1,600 transactions, people, inquiries, whatever, a week. The average caseload is over 650 for the people that we have on board. It's just unacceptable, and we're trying to get as many of these positions filled as possible. So if I get them all within this quarter, I'd be very happy. And we are kind of pushing, but then there was an interpretation, I think, from BBMR that, and whether I misunderstood it or not, I don't know, but I got a clarification from DOA that, but what BBMR said was any position that had any federal money in it was going to have to be classified as a competitive limited term appointment because the federal money has a term. Well, the SNAP program's been around for a couple of generations, I guess. That interpretation didn't seem to set right. So I asked DOA whether the circulars that they had sent out in Lou Perez's time and then was clarified by Benita, whether that really was intended for us to apply across every federally funded position. And the answer was no. Those programs that have limited funding periods, like Carinu, Launch, that have a 5-year period, those really should be recruited as a competitive limited term, because the funding, we don't know what's going to happen at the end of when the funding runs out. But some of these others, what they really intended was for the appointing authority to have the ability to recruit at a higher level above step by using the competitive limited term appointment. So that, because you'll have trouble, with people even applying for work if they know that, hey, the job's only going to last X amount of time. We lost a microbiologist who we thought we recruited for our lab programmer because there's a limited term to that. So, we were trying to get that clarified. So I think now knowing that the eligibility workers will still be brought on board as classified employees without having that restriction, we're hoping to get those people recruited, because we really have some difficulty there.
The reason why I was asking the vacancy, because I noted in your 2017 request, you're asking for 126 to fund 126 vacancies. In light of the fact that we need $8 million for those three others that we did not include within the ceiling that's been given to you and to us, if we're going to keep the governor's budget balanced. Because with those three requests, we take the governor's balance and $8 million right off the top. It's unbalanced. Can we look at that 126 and prioritize them and understand that with everything that's going on, at least for right now, say I know I really want to do the MIP 3 million. I know I really want to do the increase for the health insurance for the kids, and I know that I really want to take care of the meals. These 126, you're not going to, on the day after the budget is signed, holler and scream that I took away some vacancies from you. I'm trying to get us to all live even within the governor's budget ceiling, which may be aggressive because his revenue projection is very aggressive, and he may have been very the 99 that he gave you guys may be really more than we can afford, but I just need to know, without being, demonized by not giving you your 126 vacancies so I can fund MIP increase and the child, how many of these are absolutely necessary that you really believe that you can fill in the next year?
All right, we'll have a division heads meeting on Monday. We'll fight it out, and we'll give you the list.
Thank you very much.
Somebody's going to get hurt.
Well,
Earlier we were talking about emergency procurement, and I know that there's one emergency procurement that comes across the desk every month. It's some kind of information system, and it's been going on like that for years. Can you maybe tell us something about that?
Telephone?
Something about the supplier is the only one that can provide the IT services, or but it's okay.
If I may ask Charlene to speak on that. She's working on our Aging Disability Resource Center initiative. One moment. Charlene will switch places.
I think we have several ongoing. I mean, there's one, the matter of Guam Telephone Authority.
No, this is not Guam
Okay.
telephone.
I mean, that's gone on for years and years, and I'm still paying twice what I should be paying for phones. But that's in court, so we can't do much about that.
Okay.
There is one, okay, yeah, Charlene.
I'll go ahead. So the Aging and Disability Resource Center, initially, prior to 2014, there was a federal grant that was spearheaded with the former Guam Department of Mental Health and Substance Abuse and Department of Integrated Services for Individuals with Disabilities. Aging, the seniors stepped in initially because our plan was that they were going to take it, run it through. They got our buy-in because of the information that needed to be shared and providing like a one-stop network for those that are disabled. On us, of course, our interests are in the aging and Guam behavioral. Well, they informed us in September that they did not receive any other funding. We did not know that. We had to plan. We had all our contracts specified so that all the aging networks that receive any contracted programs would need to provide reporting information that helps us with the National Aging Program Information System. There is no current MIS system to track aging seniors, if they're receiving congregate meals, home delivered meals, personal care, chore care, transportation. So this system, we've been working with the Office of the Attorney General. We've reached out to our Region 9 Administration for Community Living, as this is our intent, just so that you're also aware and informed. This type of procurement is not something easy. I've been primary, I've done the research, I've gone back, even with at the national level, those who have put out a procurement, they've had to cancel, and I can provide that information if that is requested. At this time, all I can say, because it is something we are working on, is that we're working on it. I can't provide anything else until such time the information is available online and, through the process.
Well,
I hope that answers it.
yeah, no, I mean, it gives me some assurance that it is in fact being looked at actively and trying to be resolved.
Right, and just so that you're also aware, we are also working with the Office of Information Technology through the recent public law that encourages that any organization that is putting forth an MIS, they need to go through that entity as well. So.
Okay, all right, great, thank you.
Tess, on the foster care, the foster care insurance, the law is now the law is that we mirror the GovGuam health insurance package. So, my question is, if we were to delink from that and just do something separate, just for the needs of the foster children, because that's different. The whole government of Guam package has retirees, and there's so many different things that children won't use, right? And so that's one of the things that I've been trying to move forward. We had a bill still before us this term that attempts to do that, to delink, but still ensure that we do have this private health insurance for foster children. Is that something that we need to pursue? And perhaps if we do that, if your answer is yes, if we do that, will that have an impact on the cost?
I would not say yes or no, Senator, because it depends on the condition of these foster children. It could be just one client can have 1 million. So we don't know that. That's a risk that the insurance has to take. But if you're going to insure a small group of individual, that's high cost. But based on our experience, the expenditure of just these children is lower than what we're paying now. But I would not say that it is best if we separate them, because the risk of the insurance is there. Well, they can increase the premium the following year if they lost this year, let's say, but that will be a lot, because just one kid that costs $1 million will cost a lot.
So you're saying it costs less now?
Yes. Based on our historical expenditure, yes, it's lower. I mean, our expenditure is lower than what we're paying now.
So buying private health insurance, right? So buying private health insurance is lower than when these children were under.
No.
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 It's higher.
So it's reverse. It's higher.
reverse.
Our
Our
est-
yes, sir.
Our estimate of the cost, okay, of this program in terms of the services provided is less than the premium that's being paid. I think what we need to do, if we're going to continue to do this, why it was done, I don't know, but, we're doing it. We need to negotiate, look at, sit down with the current provider or whoever wants to do this for us and really say, this is the age band that we're talking about, this is the usual experience with them, but this is right, you can always get that one, that's out of the ballpark, it's just, an outlier. But that's, the risk insurance companies take, and they have reinsurance that takes care of those kind of things, so they're better able to take that hit than most. But when you do have a small group, it is higher, higher risk, so your premium is higher. But we think that we're probably paying a bit much more than we should, and we need to negotiate. It could still be the Government of Guam package of benefits, okay, but I think we could probably get a better rate if we negotiate it.
Yeah, I think that's, that was my point in trying to, with that bill, I think it's Bill 12 or 13, to delink, but still recognizing that we have, because I think what was happening is that foster parents were saying, look, they're under Medicaid or MIP, but the clinics are not accepting it, so, I understand. So we want to be, we don't want to give them more of a burden, so we did this, right? But I think if we kind of take a look, considering what the committee has to work on the differences in the amounts, is perhaps looking at that, because what we're basing it out of now is the GovGuam insurance plan, which, these are kids that don't take advantage of what we're paying for in that package. So maybe that's something we can explore with the committee as well. Thank you. Oh, and sorry, one more is the AC unit over in Manila. Is that a funding issue?
It's still down, waiting for the parts. Again, I think we had a discussion about, the wastefulness of the ARA money. When it came in, it was just there, and they said, here's $3 million, and we're going to do this, and we're going to do that. So they put in these wonderful air conditioning units that actually, when they first ran, you probably could use it to store meat. It was so cold in there. But they were specific units, the same units I think that Behavioral Health and Wellness has. But the company that installed and put the, and was overseen by a federal contract manager, did really sloppy work. And we have a lot of problems with the units. When they bid on the maintenance package, which was also ARA funded for 5 years, their bid was way beyond what we had estimated. So the bid was awarded to another company. So we're having difficulty with the company that supplied the original units getting timely procurement, provision of parts. And I think a lot of that has to do with the fact that they didn't get they didn't get the contract for the maintenance. So things are kind of, it's being delayed, it's not here yet, it's on the boat, or, whatever it is. So in the meantime, people are sitting in that hallway kind of suffering. We've got some fans, and the areas that are air conditioning, we try to keep our doors open so they can get some of that. But hopefully, it was supposed to be in last week, it's still not here.
So it's a parts that
it's
an issue.
It's a major part, it's a motor, but still, I'm not happy with the fairness of some people.
Yeah, just on the foster care, who's that? Are you involved, is Public Health involved in the construction project up at Barrigada Heights? Are you guys involved in that at all?
Yes, in a sense we are. It's over at Public Works now for the construction documents and that's still over there.
It hasn't gotten off the ground.
I haven't
yet?
broken. Well, we blessed the ground, but we haven't broken it yet. And there seems to be some. Again, that's why the finance people. I rely on them a lot because I don't understand what they're planning to do with. We thought we had the money through DOI. They want to do something else, and I'm still. Every time the deputy explains it to me, I get more confused. But it's at Public Works. It's looking like sometime in 2017.
Is there any way that your community health centers can assist in the problem that we're having with GMH?
If we could find some way to transport people down south, you know, in a convenient manner, you know, that meets, you know, that people don't have to wait for 3 hours to get a bus, we could probably take some pressure off. But I really do, you know, I've been quoted, and obviously there's audio on it now, that you know, that an outpatient facility at GMH is not a bad idea. Okay, in terms of the fact that their reimbursement would be higher from us. Our Dedido Health Center, Community Health Center is just overloaded, and one, we don't have enough staffing. Probably never will have enough staffing. So if the hospital is able with what staffing they have, and you know, to either expand the urgent care facility or operate the outpatient clinic out of that, you know, I really physically haven't looked at that urgent care facility to see if it can accommodate. But it's not a bad idea to locate another primary care facility somewhere. And you know, no matter what you're going to do, it's going to be there's going to be cost. We'll have to have a capital expense somewhere. So you know, the governor's idea and the management team that put together some of the ideas to enhance the revenue at the hospital or increase the revenue, it's not a bad idea. But we do have an underused center, but still not enough staffing. And that's the challenge for everybody, I think. Even if you made wages competitive for physicians, I don't know, you know, because you see that the regional medical center, city hospital is closing certain services because they can't recruit certain physicians. There are physicians there that aren't busy enough, and they're leaving. So you know, we do need more primary care, no question about it. And of course, now that Dr. Shea has said that since Senator San Nicolas has decided that all of the Medicaid and MIP money should go to the hospital, he's not taking any more Medicaid or MIP patients, and we're going to see more and more of that. You know, because of the limited number of doctors we have in clinics, they're already overloaded with their paying patients and their insured patients, and to them, business-wise, it's not worth their while to stay open. And they also, to be very frank, they pick and choose the MIP and Medicaid patients that they have. I think personally, every physician on Guam who gets a license ought to be required to have at least 10% of their patient load be MIP and Medicaid, but that's my opinion. Whether it actually happens is another matter. It's right now any willing provider who wants to take it, but they can decide under, you know, which conditions they will take the patients.
The legislature was called into almost near special session about a year ago because we had to pass some legislation to address the community health center's director.
Oh, right. That's again the federal government telling us what to do. They said that one of the quality standards was that there has to be a chief executive officer, a chief financial officer, and a medical director. You know, so if
have those positions been filled?
They have all been. The compromise was that we would use, because the chief financial officer is a special position, and there's only one of those for the government of Guam. I think the compromise was that we would use somebody from the Department of Administration to fill that function. So we did meet those requirements. We do have a CEO and a medical director.
In the medical director's position, was there creative financing in that one?
It's actually being paid out of, you know, their program income. They realize a fairly good amount of money just from their charges from Medicaid and whatever they can collect from insurance companies when they present. So the salaries are the CEO and the medical director are being taken care of out of their program income. There's no increased request to pay those.
Okay, but did they meet the qualifications that?
Yes, we have a medical director and we have a CEO.
Did I understand that there's an issue as to whether or not certified and board, there's a difference?
Board eligible or board certified? I don't recall what they were requiring, but generally it's board eligible, but you don't stay board eligible forever. You have to eventually be certified.
It's my understanding that it was the qualification was board certified.
Okay, I don't have the particulars.
No, that was for the community health center. It was supposed to be board certified, right?
No,
Ms. Archangel?
Well, that's is she here? Oh, that's right.
Mr. Chairman,
Norcy would have been able to handle
yeah, we also did that for Central Public Health when we had to do something with the medical director. That was a board certified.
That was the territory epidemiologist position.
Yes, okay.
That there was a requirement to be board certified. So with the amended law, it allowed for others who are not board certified nor with a medical degree, to also qualify for the territory epidemiologist position.
But also for the medical director. I don't know if that's what the Vice Speaker was referring to. Remember when Dr. Matthews left, we had to kind of revise the statute to be able to accommodate, and it was with Dr. Cisan, but or Kaneshiro, but she's not here too, right?
I'm just wondering. I mean, we had written all these criteria in, and then we keep. No, we didn't mean board certified. We meant board eligible, and we'll do board eligible and make some accommodations. And I just don't want to jeopardize the program if we're not complying with the program that you guys wanted. I mean, we were called into special session.
We'll verify that for you, whether it's certified or eligible. It's probably certified. If I know the feds, it's what they'd want. But we have to remember too that the community health centers are also have to be responsible to a board. They have to respond to a board. That's why I've been trying to work around this idea of they should actually become a 501c3, do their own thing so that they're not encumbered somewhat by the government classified system, and they're eligible for other grants, as long as we make a commitment to them to fund our share. And I think that's been one of the concerns, that if they were separate somehow as a not-for-profit, that they would lose our support. And that's obviously
Pass-throughs. How many pass-throughs do you have in your budget? Like
food stamps?
No, like Catholic social services.
Oh, pass.
None?
Don't know if that's a pass-through.
Well, you have contracts with them. I'm just trying to figure out if are they currently being paid, or is this a question that I'm going to be asking Ray when we get to 11 o'clock?
We've had some delays. We process in a timely manner. It's got to do with how DOA is managing cash. I know we had that situation with Catholic Social Services, which was resolved, and actually there shouldn't have been any payless payday. We had that resolved for them, but nobody bothered to pick up the check until following Monday.
Okay, because I just happened to be on Facebook that morning when I saw that was the first thing that popped up, and so that's why I'm asking: are we current with these pass-throughs so that I don't wake up to those people? I mean, fortunately, at least they didn't attack me. I mean, it was the governor that was And so I'm just saying, I mean, is there an issue with those?
I think, again, that we may be a little bit, as far as processing, no. As far as them actually getting on a timely manner, that, sometimes is a problem for DOA.
Okay, but you signed off and sent
yes.
it down to DOA. It's a DOA where the holdup is at.
Yes.
Because you're signing.
Yeah, and I understand her difficulties, and the cash flow is definitely a challenge.
Okay. Okay, so I just have to find you an additional $8 million that wasn't budgeted for. And when you look at the vacancies, I won't mention the other one issue. I'm not sure if that's something that we want to be talking about in public at this point. Determine whether or not you're still going to insist on it. I'll try to spare that being the headline, so let's just reconsider some of the positions. We need to find $8 million. Let's try to find the $8 million together without asking for some other things, okay?
Yes. Thank you.
Thank you. Do you have? Okay. We stand in recess until 11 when I start the behavioral health and wellness.
Thank you, Mr. Chairman.